We know a lot of the issues that our clients face that cross over our agencies are increasingly complex, and many of these people simply don't have the ability to navigate the different parts of government as we are currently organised. So how are we going to actually bring ourselves together in a way that we can make it easy for them? It's actually information sharing, data, analytics, shared ways of describing and understanding our clients where they cross over the multiple agencies. So structuring information and having that information available is really important. The other component, which is probably underestimated but is probably the biggest issue, is cultural. It's actually people in government agencies being prepared to share, being prepared to work together, and in some cases being prepared to let go and allow others to fill a gap where it might currently exist. Well, I think we've got some good examples. One that springs to mind is the children's teams. So in that instance, you've got a multidisciplinary group of practitioners from across different parts of government and indeed the wider social sector, including NGOs, iwi partners, etc. They come together to actually look at it from the perspective of the child and the child's family, and to actually design services in a way that is going to, avoid all these bureaucratic components, and actually just zero in and focus on what does the child need, what does the family need, what barriers might there be, and how can they collectively overcome them. With the children's teams, we're already getting better attendance at health appointments. So that's a signal that we are managing to overcome some of those barriers that people are finding. I think another really good example is the collaboration between the broader social sector around rheumatic fever and housing. We've identified a principal cause of rheumatic fever is actually overcrowding, and working with the people that are making decisions around housing to push people up the list, because the criteria of being at risk of rheumatic fever is actually enabling them to get further up the list and more likely to get a house sooner. Some of it is actually just the practice of working together, and we have been doing that increasingly in recent years, and people are getting better at it. And some of it then is systems and processes, making sure that we have a single way of describing our clients, that we are collecting the information that's actually going to matter, that we are then making that information available, and then making decisions off the back of that information. And that's what the investment approach is really all about. Collect the data, gain some insights from it, and then take action in the right places.